Hello, my name is Alex, and I am a 5-year-old, and I am in kindergarten. I don't like my face. I feel tight and sticky on my skin. It started with a spot, and it looked like bug bites, like when I play outside. And then it got angry, like a bubble, and my mom told me, don't scratch. But then I scratched, and it popped. Now it look sticky, honey, like honey and boogers, and it's all on my face. I have two older brothers I share a room with, and they make fun of me, and the kids at school laugh at me, and I don't like it. I feel like I have glue on my face, uh, like when I play at school. It can be itchy like the angry ants on the playground, and spicy like the hot food that mom cooks.
Hello, my name is Selena and I am the parent in this case. I am bringing my son in today for a rash around his mouth that keeps getting worse. It started around 4 days ago with a small red spot. At first I thought it was some sort of irritation since he does play outside a lot, but since it hasn't improved, I began to worry. I wanted to bring him in sooner, but I've been so busy working that I haven't had the chance to. The small red spot formed into little blisters that broke open and left these yellow crusty scabs. They seem to be spreading to his nose and chin. I'm worried it's contagious and that it's something that would be difficult to control with the other kids at home and me working all the time. He says it itches a lot and he keeps touching it, but it doesn't hurt. It just doesn't look good, and he's been telling me that he's been made fun of recently by his classmates and it's upsetting him. I can't think of anything that's been out of the ordinary recently. He's been eating like normal, he's been playing like normal, he hasn't been sick nor had any fever. Although I do remember that one kid in his class seemed to have something similar recently. I just want to make sure he gets the right treatment and it doesn't get worse. As a parent, it's important I learn the severity of the condition, understand the treatment regimen given, and also understand the importance of compliance to it, to ensure that my son improves.
Hi guys, I'm Persia. I'm going to be the nurse in our scenario today. As the nurse, I conducted intake and triage for a 5-year-old male presenting with a 4-day history of a spreading rash localized around the nose and mouth. I obtained a focus history from the parent regarding onset, progression, and associated symptoms, as well as potential school exposure. Vital signs were assessed and found to be stable for a pediatric patient with no evidence of systemic illness. On examination, I documented superficial honey-colored crust lesions without fluctuance surrounding cellulitis and no enlarged lymph nodes indicating signs of deeper infection. I assessed the risk of transmission within the school. Education was provided to the parent regarding infection control measures that include hand hygiene, avoidance of shared personal items as well. All findings were communicated to our provider, the PA, to support diagnostic confirmation, treatment planning, and follow-up coordination.
Hello, my name is Mercedes and I'm the physician assistant that will be working with this case today. As the PA, my role is to lead the clinical evaluation and the management of our 5-year-old patient. I began by washing my hands and then obtaining a focus history, including onset of the rash, associated symptoms such as itching or pain, and any recent exposures such as daycare or skin trauma. On the physical exam, I am looking for characteristic findings, in this case specifically honey-colored crusted lesions, which this is the hallmark for impetigo. Based on these exam findings, I can make a clinical diagnosis without need for any further testing. I then determine the appropriate treatment plan for our patient, and for this localized disease, I would prescribe a topical antibiotic such as mupirocin, while more extensive cases may require oral antibiotics such as cephalexin. An important part of my role is to also give the patient and their caregiver education, which this includes proper medication and hygiene measures to prevent spread and guidance on when the child can safely return back to school. Early recognition and treatment are important not only for symptom relief, but also to reduce transmission, especially in pediatric populations. I will also further collaborate with the healthcare team to ensure effective and coordinated care.
Hi, I'm Shauna. Dermatology Supervising Physician. My role is to oversee the evaluation, diagnosis, and treatment of a patient by the PA. In this case, I do agree with the assessment and plan made by the PA of the suspected impetigo, and I also guide the healthcare team and ensure that evidence-based care is utilized. I confirm diagnosis by reviewing the PA's history and physical exam findings. Impetigo is typically identified by honey-colored crusted lesions, most often caused by Staphylococcus aureus or Streptococcus pyogenes, which are part of our normal bacterial flora. When evaluating lesions like this, it's important to consider a differential diagnosis. For example, herpes simplex virus typically presents with painful grouped vascicles rather than a crusted lesion. Contact dermatitis is more diffuse and associated with the clear irritant exposure, and tinea infections tend to have annular scaly borders. The absence of pain, systemic symptoms, and the presence of the classic honey crusting strongly support impetigo. I also confirm the appropriate treatment plan, which in this case is the mild localized impetigo, supervising the use of topical antibiotics like mupirocin. I authorize oral antibiotics and adjust therapy based on culture results if it's needed. Overall, early recognition and appropriate treatment are key to preventing spread and ensuring resolution. I'll now hand it back to the team to continue management and the patient education.
Hi, my name's Reagan, and my role as the school nurse in this case was to identify potential health concerns, prevent the spread of communicable diseases, and act as a liaison between the health provider, the student's family, as well as the school. And when I saw the student having honey-colored crusted lesions around his mouth, I recognized them as classic signs of impetigo, which is the highly contagious skin infection common in young children. And I notified the parents and recommended he be seen for medical evaluation for proper diagnosis and treatment. And after treatment was initiated, I requested the medical visit note for school documentation and communicated directly with the PA to confirm the treatment plan and ensure that his return to school timeline was aligning with the CDC-based school guidelines. And I also monitored for additional cases in the school and reinforced hand hygiene, proper surface disinfection, and avoiding shared personal items between the students. And I also communicated with the social worker to address any barriers to completing the treatment for the student, such as applying mupirocin at school if it was difficult for the parents to do at home due to busy schedules or family responsibilities. But my overall role was to protect the student health, reduce transmission, and promote a safe and supportive learning environment.
Hi, my name is Jordan Perry, and I am the social worker. So as the social worker in a pediatric impetigo case, my role would be to assess and address any psychosocial or environmental factors that could impact the child's recovery and prevent further spread of infection. Because impetigo is highly contagious, I would specifically evaluate the family's ability to implement infection control measures at home. This would include assessing things like access to clean running water, soap, and especially regular laundry facilities, because things like clothing and linens are going to need to be washed daily at this point. Additionally, I would assess the family's ability to obtain and afford antibiotics and reinforce the administration education provided by the PA at that initial appointment. And then if any financial or transportation barriers were to present themselves and interfere with this treatment plan, I would be able to connect them with the pharmacy assistance programs or even the community resource programs at that point. I would also coordinate with the child's school regarding the appropriate return to school guidelines, given that the child had been on antibiotics for 24 hours at that point. And I would also be there to help provide education to help reduce any stigma. Overall, my role is to ensure the treatment plan is attainable within the family's circumstances.
Hi, my name is Shayna, and today I am speaking on the role of the pharmacist in an impetigo case. As the pharmacist on an interdisciplinary team, my responsibility is to review and verify the prescription written by the physician assistant or other healthcare provider to make sure it is complete and appropriate for the patient. I confirm the medication choice, dose, route, and directions. I check patient-specific factors such as age, allergies, and medication history to help prevent interactions or adverse reactions. If the selected medication does not fully align with the documented diagnosis or patient factors, I communicate medication-related recommendations back to the provider to support safe and effective treatment. My role is focused on medication safety, appropriateness, and ensuring the treatment plan is clearly communicated within the care team. For impetigo, treatment may be topical or oral depending on the extent of skin involvement. Topical therapy is typically used for limited lesions, while oral therapy is used when lesions are more widespread. As the pharmacist, I help confirm that the selected treatment is appropriate and safe within the overall plan of care. If cost becomes a barrier, the pharmacist can work with the provider to identify insurance-covered or lower cost alternatives and help prevent delays in treatment. Thank you.
Hello, my name is Sarah, and as a policy analyst reviewing this pediatric impetigo case, my role is to examine how healthcare policy, school regulations, and social net safety programs affect Alex and his family. Although the clinical team diagnosed localized non-bullous impetigo and started topical antibiotics, access to that care often depends on programs like Medicaid and the Children's Health Insurance Program, which help low-income families afford visits and medications. Policy gaps such as the lack of universal paid sick leave can delay care when parents must choose between work and taking a child to the doctor. In schools, public health guidelines require children with impetigo to stay home at least 24 hours after starting antibiotics to help reduce transmission, while privacy and anti-bullying policies help protect students like Alex from stigma. Broader social policies addressing housing, food security, and prescription coverage also play an important role in supporting treatment and preventing the spread of infection.
The case that was presented followed a pediatric 5-year-old patient that came in with his parent who spoke about symptoms of an itchy red rash around the nose and mouth that progressed into honey-colored crusts. The nurse assessed the patient. This was communicated then to the physician assistant, who began with a detailed history and recognized the hallmark symptoms of impetigo, and then made a clinical diagnosis and prescribed a topical antibiotic such as mupirocin and gave hygiene education. The dermatologist agreed with this diagnosis and care plan and assisted with ruling out the differential diagnoses of herpes simplex virus, tinea infections, and contact dermatitis due to the absence of pain, systemic symptoms, and the hallmark symptom of honey-colored crust that supports the diagnosis of impetigo. The social worker addressed any psychological and environmental factors with the case and that may impact the child's recovery and resource options. The school nurse discusses preventing spread in the school environment and how preventing the spread with proper hygiene techniques. The policy analysis discusses the impact of proper health policies on this case. Finally, the pharmacist discussed the prescription to verify the drug, dose, route, and checking for any interactions. Overall, this case showed the collaboration between members of the patient's care team and factors that go into the health outcomes for this patient and his family.